Good morning. We knew we had to start a few minutes after the appointed time because you all would be having so much good conversation when you saw each other in the morning. Welcome. I'm Joanne Spetz. I'm the director of the Institute for Health Policy Studies, the Philip R. Lee Institute for Health Policy Studies, named for Phil Lee, who was the first ever Assistant Secretary of Health and Human Services in the federal government. He was involved in the implementation of Medicare and Medicaid and believed that everybody deserves access to good health care. So that mission continues with IHPS, and I think also with UCSF is something that we all believe. And we might disagree on the ways to get there, and that is why our research comes into play, to help inform how it is that we design policies to be the most effective at achieving better health for all people. So this event is always a huge highlight. This is our fourth in-person HSR symposium. The first one was supposed to be in May 2020 under Claire Brindis's leadership and development. That was going to be a huge, wonderful event, and instead we were all sitting at home buying too much alcohol or something. So it ended up being a virtual event that year, which was very successful. I think we were all not Zoomed out yet and grateful to see each other even on Zoom. And then we were able to do an in-person one in 2022 to celebrate the 50th anniversary of IHPS. So here we are on the next one in person. So we are really happy to get this program started. We're especially honored today to have our welcome speaker of Dr. Jeffrey Reynoso. Dr. Reynoso is a public health leader and has a commitment to advancing health equity and social justice through health policy and system changes. He has a really interesting background with experience in academia, government, and nonprofit, nationally, state level, and local level. Most recently, he was appointed by President Joe Biden to represent the administration as the regional director at the U.S. Department of Health and Human Services Region 9, which is our region. So he got to hang out here in the Bay Area. Previous to that, he was the executive director of the Latino Coalition for a Healthy California, which I think most people here are familiar with, and if you're not, go look them up. They're super cool. He also has served on multiple boards, including for Insure the Uninsured Project and the California Pan-Ethnic Health Network. And he is involved in a lot of different state government committees and programs because of his expertise and deep commitment to the state of California. He has also been awarded for his work, and he asked me to not go through the whole brag list, but we can share it with you. He holds a Doctor of Public Health from Harvard University, which has made a lot of press lately at Harvard, and a Master's of Public Health from UC Berkeley, our friends across the Bay, and a Bachelor's from UCLA, our friends down there. He worked with Inez Ponce, who many of you know is the director of our sister center at UCLA. His background as the son of working-class immigrants from Mexico raised in California's Central Valley and North San Diego County informs his work, and I'm going to hand it off to him to kick us off today.
Good morning. Buenos dias. So I was asked to come out of sabbatical. I've been pretty much just relaxing for the last 3 or so months since I had to step away from my role as regional director at HHS. And, I think I want to thank Joanne for the invitation, Beth as well, and Sunita, and Dan for bringing me out of sabbatical and putting together kind of my thinking. I've had a lot of time over the last couple of months, the first 100 days, today's day 100 of Trump 2.0, so a very momentous day today, and putting together my thoughts on what is the state of health policy and equity today, what are the threats, we'll talk about some tactics because I am optimistic. I do think the old playbook is still relevant, but I think we need to dig our heels a little bit deeper. And what does that transition look like into the future? No disclosures to report. I currently have no affiliation, which is kind of nice. I can actually say what I think and not be worried about what my bosses are going to say. Before I get started, in the intro, I'm a son of immigrants, and optimism is in my DNA. So I want to start with the good before we get into some of the bad. We accomplished an incredible amount under the prior administration, and there's a lot that I'm proud of with a lot of work that we put together and we accomplished with my colleagues at HHS. We have to remember we were handed a country in the middle of a once-in-a-century pandemic. We achieved the largest adult vaccination program in U.S. history, and under Secretary Javier Becerra's leadership, the prior HHS secretary, we not only achieved that, but we did it with equity at the center and equity in mind in our design. There were no gaps in COVID-19 vaccine rates among racial ethnic groups, and that was thanks to the work of incredible partners, state and local, our nonprofit partners, and we invested in to meet communities where they're at. We also expanded access to quality, affordable health care for all Americans, the most in our nation's history, over 300 million, whether it's through Medicaid, Medicare, or the marketplace. A couple of really key initiatives that have been transformational. We'll talk about where these are headed. Under Medicare, for the first time in history, we were able to negotiate for prescription drugs directly with the manufacturers. We started with 10 drugs initially, and that's been really impactful in terms of actually starting to lower the cost of healthcare. With the marketplace, we expanded tax credits, and we doubled just within our administration something like from 12 to 21 million, so more than doubled the amount of Americans on ACA marketplace plans. And for Secretary Becerra, he has been a long champion of immigrant health and immigrant health access. We expanded DACA eligibility under the ACA marketplaces. That's in the courts, and it's probably not going in a good direction, but we'll talk about how we defend against that. Some more wins. It's hard to, I could probably spend an entire presentation on probably one of these bullet points, but we supported our nation's behavioral health system, expanded 988, the crisis suicide hotline, and again, doing it with equity in mind. We expanded chat, text, and phone calls in Spanish. We launched a partnership, a nationwide partnership with the Trevor Project, so focused on LGBTQ plus youth. We had a tribal hotline as well that we launched, protecting and expanding reproductive health as much as we could. Obviously, the Supreme Court in the Dobbs decision, reproductive health was under attack, but we did everything we could at HHS through our regulatory authority, expanding, over-the-counter contraception, for example. We worked really closely with our tribal nations, advancing advanced appropriations under the Indian Health Service for the first time in history, so really giving them some stability in their financing, which is so critical. We know that our Alaska Native Indian American communities just suffer a tremendous amount of disparities and are often in rural and remote regions of our country. Under CMS, we expanded coverage for the first time. I think this was one of our last actions. We were tasked by the President and the Secretary to run through the tape, and we did. I think the last month we passed or approved CMS waiver authority for actual billing of traditional healing practices in Arizona and Nevada, and California, so that was a big win. Also addressing the social determinants of health. The Secretary, I think it was maybe after the first year when he presented the HHS budget, he said we're shifting our country's healthcare system into a wellness system. So from sickness care to wellness care, and that means addressing the social drivers of health, the social determinants of health. So we did quite a bit around addressing the climate crisis and its impact on health, on addressing housing insecurity. We launched the first Office of Climate Change and Health and the first Office of Environmental Justice. Those have now since been shuttered, so we'll talk a little bit about that. I worked really closely with HSIs here in California, the CSU system, on establishing partnerships, increase diversity, equity, and inclusion in our health workforce. Again, that's under attack. And we developed, better partnerships here nationally and internationally to support our public health infrastructure. Under Secretary Becerra, we shifted our ASPR division, so this is our Public Health Preparedness and Response division, from a staff to an operating division, so really elevating its staff capacity to respond to future pandemics. We championed the first international agreement on pandemic preparedness and response. I'm not in the global health space, but I believe that document has been agreed to, and I think it's going to be signed pretty shortly, probably in early May, by the full WHO. And investing in research. I hope you all have been, hopefully in the past, recipients of some of those dollars that we increased in things like the Cancer Moonshot and the White House Initiative on Women's Health Research. But we are in a moment of extreme threats. And I was a political appointee, but what I like to say is my political affiliation is just one part of my identity, who I am. I really start my work and my training has been in public health, and so I lead with public health first. It kind of made me a unicorn sometimes amongst my peers. I was probably the least political of the political appointees, but I don't say that as a bad thing, because I do think that sometimes we do have to get political to really push against some of the threats that we're currently under in this current administration. So I mentioned earlier we are at day 100, and what has happened to public health. So Stat News has documented pretty much every action taken by Trump 2.0 to the Health and Human Services framework of the country, and it's a lot. Raise of hands, who's overwhelmed by everything going on? Yeah, I feel it too. It's still going, right? Yeah, it's hard to keep track. But I think this is intentional, right? This is an intentional strategy. I remember on a flight I was taking from SF to Honolulu, one of my trips to Hawaii, one of my states in the region, and I was reading one of the leaked drafts of Project 2025, the HHS chapter, and during that flight, I had a moment. I'm like, they actually are going to do this. Like, they know what they're doing. They learned a lot the first time around. And it's very sad. You kind of have to mourn some of it. But I hope that we can get into a discussion about what I think we can do, and would love to hear from all of you how you think we can protect against some of these threats. So from the Stat News, I just pulled out just the attacks on NIH research. So we're just focused on one aspect of NIH research, and it's been a lot. I think April 3rd, the DOGE announced that they were cutting $2.6 billion from NIH research, biomedical research, and I know that's having a big impact. If I'm not mistaken, UCSF is the highest recipient of NIH dollars of any institution in the country, so you all are definitely impacted. And I will say, I try to be optimistic, and I am hopeful. On April 22nd, I mentioned the White House Women's Health Initiative, the Women's Health Study that's been in place for about 3 decades. They said that it was going to lose funding by September. There was a lot of pushback. It got a lot of news coverage. I believe Maria Shriver, our former First Lady in California, probably made a call to her cousin, and April 24th, that decision was reversed. So I do think that there might be signs that, the pace might be pausing, and there might be an opportunity to push back or, kind of reverse some of these cuts. I did want to spend kind of a few minutes talking about the doging of HHS because it's really impacted the work that I did for 3 or so years under the prior administration. So on March 27th, Secretary Kennedy, RFK Jr., he put out this reduction in force plan. So, call it a restructuring, but it was really a hollowing out of HHS. They announced 10,000 cuts, and with the fork in the road, so this was earlier days, some federal employees were offered an opportunity to get, early release from HHS. So with that and some of the early retirements, we're looking at anywhere from 82,000 full-time employees to 62,000, so about 20% or so of the workforce. I don't know how you can do it because when I was at HHS, we had, at some point in time under Secretary Becerra, it was about 90,000 employees. Only about 125 of us were political appointees, so the vast majority of those 90,000 are career civil servants. They're there to be there in service to the American public, regardless of party, promoting science and public health for all Americans. And these are the people that they're cutting. The HHS regional office closures, so they announced that they were going to cut down from 10 to 5. But I want to talk about what that means. I mean, it's one bullet point in one memo among, hundreds of actions. So as was mentioned, I was, in my prior role, I had the honor of being regional director for the Southwest and Pacific region. Our headquarters were just down the street at the Nancy Pelosi Federal Building off of Market. So 10 regional directors across the country. But, this last point I think is really important. So regional directors ensure that HHS, so the department, maintains close contact with state, local, and tribal partners and addresses the needs of communities and individuals served through HHS programs and policies. So when I was being trained in public health at Berkeley, I remember public health happens locally. If you're not there in the community, how can you develop effective public health policy? So what was our charge? So the regional directors sit within the office of the secretary, and our function is primarily intergovernmental and external affairs. So on the intergovernmental side, working with our intergovernmental partners at the state and local level, so whether that's members of Congress, senators, governors, mayors, boards of supervisors, city council members, but very unique to Region 9, and why I think Region 9 was such a special place. We're the region with the second largest, or were the region with the second largest amount of tribal nations within our footprint. So 157 federally recognized tribes, and that's a nation-to-nation relationship. And we were also one of 2 regions in the country that worked really closely with U.S. affiliated territories. So I think Region 2 was Puerto Rico and the Virgin Islands, and within our region, we worked really closely with the U.S. affiliated Pacific Islands, so Guam, American Samoa, the Commonwealth of the Northern Marianas. And, these relationships take time to build. And we also worked on the external affairs side with our non-governmental partners. So responding to emergencies and being there on the ground. So I think top left, that was a trip that I did to Lahaina and Maui in the aftermath of the wildfires. So working with FEMA, Small Business Administration, providing behavioral health emergency response. I think bottom left was not too far from here in Half Moon Bay. So the shooting that happened, and again, providing mental health supports through our ASPR behavioral health division. And I was able to find some pictures. Google, I mean, iPhone AI is really good. I actually use that search function. I was able to find some pictures from a visit to UCSF, SF General. On the top right, Secretary did a visit there. And on bottom right, I drove down to Fresno for match day for UCSF Prime. So that was a really great visit to be there. But what I'll say on the external affairs side, it's not so much that engagement, but what we would take away as regional directors and my team and my colleagues that I work with. What are the challenges? What are we hearing on the ground? I would write up a memo weekly, and that go directly to the secretary. Some of the priority issues will go directly in a briefing report to the White House. So really understanding the needs of community. And I'll just close out with this slide. Intergovernmental and external affairs, but I had to kind of put my flavor and my spin to it as regional director, and I came from a community health background. So I did the most that I could to meet community where they're at across my region. I was always on the road, and ensuring that the voices, the most marginalized, were heard in policy discussions as we were developing policy in DC. We were the most diverse administration in history. The secretary would always challenge us, let's not wait for the American people to come to us. Let's go to the American people. We hosted the first Latina Health Summit in DC. We hosted the first Black Health Summit. So a lot of progress. So a little bit more, and then I promise we'll move on. But again, this is all to just give you some more context into what is going on at the moment at HHS. So these were formerly the 10 regions. I mentioned Region 9, so 4 states, California, Nevada, Arizona, Hawaii, the U.S. affiliated Pacific Territories, 157 tribal nations. I'm going to spotlight Region 10, which was also part of the RIF reduction, so that's our Seattle colleagues. So that was also 4 states, Washington, Oregon, Idaho, Alaska, and they have the most amount of tribal nations with Alaska, so 272 federally recognized tribes in total. So somehow Region 9, Region 10 will be merged with Region 8 in Denver, which has, about 6 states, 32 federally recognized tribes. So my question is it efficient? So, Region 8 in Denver, they're going to somehow absorb, with the same number of staff, 14 states, about 461 nations, federally recognized nations. It's impossible, right? And it's also very intentional. So while the stated aims might be efficiency, I would argue it's ineffective and damaging. I also wanted to talk about who, just really quickly. And it's not just me, right? So I'm the regional director, but I worked really closely with my regional administrators. So these are leadership here in the regions that represent various operating divisions within HHS. ACF was cut, or Administration for Children and Families, so that's the human services side of Health and Human Services. Our Administration for Community Living regional administrator was cut, so they represent programs for older adults and people with disabilities so that they can age in their community and be not institutionalized in a nursing home. It's a lot. I sometimes had days where I was wondering, is it worth to keep fighting? And then I remember, we've been here before. So let's transition a bit. So this next kind of portion of my talk is, what are the tactics? When it comes to policy advocacy, I have a table in a bit. There's different puzzle pieces. It's a little messy, right? The puzzle is a little bit messy. Sometimes you lose a piece, right? And it's hard to find it. But put together and building effective advocacy towards health and public health policy is important. I think as I see signals of what's happening is a resurgence of what used to be called the resistance, right? And I think that there's an opportunity for us to dig our heels, really have a moment of clarity on what it is that we need to do and chart a way forward. So I believe this is from Protect Our Care, their national organization. They've been organizing rallies against the congressional cuts to Medicaid. I know UCSF has been involved in some of those efforts in protecting our healthcare for the most vulnerable. I wanted to, we are at a research institution and we love frameworks, so I added a framework to my slides there for y'all. And this is a framework that I've used quite a bit over the last couple of years in my career. The Bar Heist of the Bay Area Regional Health Inequities Initiative, so that's all of the public health departments here in the Bay Area. They put together this framework quite a bit ago. I think it was early ACA days on, what are the, excuse me, what are the structural drivers of health and racial inequities? And the old school way of public health, I call it old school, but they say current public health practice, health education, case management, while important, is not sufficient. We really have to move upstream and build public health capacity for capacity building in community, for community organizing, civic engagement, strategic partnerships, and advocacy. And I would argue, as any good academic, I'm going to be critical of the framework. So I had a disability status up there as an upstream driver of health inequities, because I think that's really important. Narrative change. And I'll talk a lot about narrative change because I do think that it's once we identify or once we figure out what is the story we're going to tell about who's deserving of health rights, and who is not, and if we don't combat through a full narrative, I think the policy is going to be lost. So here's a table. I had probably about 10 slides of information. I'm like, let me just condense it into a table. What are the tactics, specifically for you all, primarily clinicians and researchers? What can you do, right, when the attacks feel so distant to the work that you do, maybe in a clinical setting or in a research setting? And I was talking to Joanne. I know many of you have been involved with the Institute and you've been trained on some of these tools, right? On legislative and policy advocacy, being able to work with the media, share your narrative. And I think what I'll say here, and the point I want to make is, all of this matters. So whether it's a short-term engagement, you go to a committee hearing in the legislature of a bill, of a topic that you're maybe interested in or your research supports, that's important. But being engaged longer term in a policy campaign, maybe we need you there. Going to Capitol Day or joining a march as an individual is important, and we need more of that, but being part of a broader coalition and building power together is more needed. Ongoing, joining a professional society. I know many of you are part of one, and I say engagement in professional societies. Some of them don't get it right all the time. I think CMA sometimes, or the American Medical Society, they get a bad rap sometimes, but they're made of their membership, right? And so if you're there, you're engaged, you're able to support what they advocate for. Many of you I know have been involved with joining a nonprofit board and adding your expertise as a clinician or researcher. We need your skills and your advice as part of the development of organizations. And I know UCSF has a pretty active advocacy network. We are in the Bay Area and San Francisco after all, so continue being engaged there. What I did, so starting where it's easy, just taking that first step. whether it's sharing your research. I know many of you have developed one-pagers or policy briefs, maybe making infographics out of your complicated research to, make it simple for and accessible diverse audiences. That's important. I would say in the longer term, what's important is developing what I'm calling here community and policy responsive research. What I mean by that is research in a vacuum, not very helpful. But research when you're talking to policy organizations, coalition organizations, what are their needs in the moment, more impactful. Being in community, whatever that means to you, I think it's important as we build a longer-term policy advocacy ecosystem. So I have a few minutes here to talk about what that may look like. A campaign that I was involved with in my prior hat, being in state health policy in Sacramento at the Latino Coalition for Health California. We were a steering committee member for the Health for All campaign. So on the legislative and policy advocacy front, we worked really closely with our co-chairs for the campaign, so that was Health Access California and the California Immigrant Policy Center. Some of you may be familiar with these really great organizations. I mentioned I was part of the steering committee. What was important there, as we know in any legislative effort, is having those champions on the inside, right? Inside the building. Initially, with the first bill of Health for All Kids, that was Senator Ricardo Lara. Later on, Senators Maria Elena Durazo and Assembly Member Dr. Joaquin Arambula, they were really critical in championing this effort through, downturns in the economy and pretty challenging state budgets. And ultimately, the campaign for all healthcare access, regardless of status or income, had to be incremental. So we started with kids, then it was young adults, older adults, and then ultimately the full expansion, California being the first state in the country to expand to all age groups regardless. And that's just the practicality of policy and politics, is you have to make those incremental steps, and it may not be transformation right away. But I also wanted to point out, I think administrative advocacy gets lost. We focus so much on the legislative and budget advocacy piece of it. Administrative advocacy, what do I mean by that? That engagement with the agency, right? Whether it's California Health and Human Services Agency here in California, the governor's office. There was a moment when the Newsom administration started back in 2019, they had a vision for California for All. That was kind of their motto, their framework for governing, and it fit really nicely with a Health for All vision. So we worked really closely, hand in hand, with the administration around the Health for All, and I think that was equally as important, having that administrative backing. Grassroots organizing mobilization. What I wanted to point out here, what was unique about the Health for All Coalition, it was a health policy campaign that was in true partnership with the immigrant rights movement. So the California Immigrant Policy Center and their network of immigrant rights organizations. And that's important because we were, at the time, the immigrant rights movement had quite a bit of successes here in California around undocumented driver's licenses, for example, some professional certifications being expanded to undocumented immigrants here in California. And so it was really that unique blend of really grassroots organizations and leaders partnering with, I call them, the nerds, the policy nerds of health policy nerds in Sacramento, working closer together. And, there was a lot of tension with that. It was a very real tension. But I do think that those conversations and that tension got us to those successes and were really critical in the success of Health for All. I did want to highlight the research. So I'm going to skip actually media and public awareness for a minute. The reports from UC Berkeley, UCLA Labor Centers, UCLA Center for Policy Research, I'm sure your center here, institute here, really important. The data, we talk about evidence-based policy, right? We need researchers, we need data. And what was, I think, really important about the partnership with the coalition and the research centers is that there was that communication, that two-way communication of what was it that we needed, right? Some of the CalSIM models I think that were used were by county, by assembly and state senate district, and that was really helpful in our advocacy. It's nonpartisan, right? You're just stating the facts. X number of undocumented kids in your district, and you have more than, you know, your colleagues' district. So what are you going to do about it, legislator? How are you going to vote? And then finally, this media and public awareness. I keep talking about shifting from just, you know, short tweets or X, whatever they're called. I think we're on Blue Sky now, right? And just shifting from like these short moments of communicating, but really establishing a narrative. And the California Endowment, other funders really invested in what was called the #HealthForAll narrative. And it was really about who in California is deserving of healthcare and who is not, and having a more complete picture of who Californians are. So there were a bunch of billboards. I think they paid for 100, 150 billboards across the state. Some of you may have seen these. I mean, this was a while back, probably a decade ago. California was born in me. So I may have not been born in California, but that California spirit was born in me. A lot of DACA health professionals were a part of that. There was a group, Pre-Health Dreamers. I believe some UCSF medical students were involved with that effort, and they were really critical in being very strong champions and voices for the Health for All movement. So these last 15 or so minutes, talking about transition. So we talked about the tactics. I still think they're relevant. Now, the assault is at an unprecedented scale and just speed. So I think that we just have to be as quick, and we have to dig our heels in, right? This transition is not going to be easy. I was really proud. This is an article, KQED here in the Bay Area. A couple of days after the office closure, HHS here, the regional office, some of my former colleagues at ACF, ACL, and HRSA, they spoke to the media and shared the story, what the impact of their position is going to have on health and human services delivery here for not only the Bay Area, but broader California and the region. You know, this transition or this reorganization of HHS was, no surprise, very messy. There was no plan. I got a call or a message maybe last week from our tribal coalition here in California, and they didn't know who to talk to. These are tribal leaders, and we had to say we don't know either. You know, maybe talk to Denver, but we don't know who the tribal liaison is anymore. And there, you know, some congressional authorities there that were required to meet, and so we're not meeting some of those congressional obligations because of these disruptions to the workforce. So what does the resistance look like at the federal level? I wanted to share some opportunities for engagement in this current moment. There is a lot happening. I've been, you know, pleasantly surprised because I do think that earlier in the Trump 2.0 administration, there did seem to be kind of, everyone was kind of in a state of shock, kind of how you're all looking at me right now. Just playing. You know, I think there was a moment, and I talked to so many colleagues in this, you know, in my world. I do think it was a cumulative kind of exhaustion. You know, there was that Trump 1.0, and there was a lot of really great work that happened, and then we went into a global pandemic, and then we had to come out of that global pandemic, and it seemed like things were kind of stabilizing, and now we have to kind of start again. So, I think rest is good, but I am really excited for some efforts I'm going to share right now, where I do think that resistance and kind of the old playbook of resistance is working. So on the Trump administration cuts to HHS programs, two initiatives that I wanted to highlight. The first is a volunteer effort of HHS 44 and HHS 46 alums. So just a group of us getting together and really collecting stories of what the mass firings, the pay stoppages, the cancellation of contracts and grants across the country are actually, what impact that's actually having. So that's the website. If you know colleagues, if your grants have been cut, I encourage you to go to the website. There's a forum. There are calls that are regularly being organized as well via Zoom. And my colleagues, those that have those relationships with reporters and the media at the national and regional levels, are connecting those stories to reporters. So really telling the American public the full story of what's actually happening and the impact of these cuts. I think to date, we've collected over 80 stories, and we connect them to reporters, and I'm sure you have been following some of those stories. We're also aligning with other similar efforts, the Impact Project, and this is a long name, but they're called the Coordinated Effort to Protect and Strengthen Civil Service and Government Institutions. So efforts there to protect or tell the story, because I think the stories are important in this moment of what the Trump cuts to HHS are doing. There's also, on the public health side, an initiative of the American Public Health Association for Our Health. So I'm involved with this effort, again, volunteer-based, volunteer effort, really calling public health professionals, advocates, those that are concerned of cuts to CDC and our public health infrastructure. I mean, the cuts to local public health are just enormous. I have so many friends and colleagues that work in local public health here in California, and they're having to think about what staff they're going to keep, what programs are going to continue or not. And this effort of APHA, so it's a companion effort of APHA, is starting to get some steam. A couple of weeks ago, we put together a sign-on letter signed by 100 former HHS secretaries, CDC directors, former surgeon generals across political administrations and ideologies dating back to the Carter administration, Bush 1 and 2. We did get one Trump 1.0 official, the former Surgeon General, Jerome Adams, he's great, to sign on and really uplift what CDC cuts will have to our public health infrastructure in this country. A second area where I see a lot of promise, we talked a little bit about, or I heard earlier about the cuts to Medicaid. I mean, this is going to have dire effects for the lowest income Americans if the Republicans get their way and cut that something like $880 billion to the Medicaid program. So there are efforts, and this feels very familiar to me. If we think about Trump 1.0, it was that first summer, so it would have been summer maybe 2017, 2018, I forget the exact year. But there were all of those congressional plans to dismantle the ACA, dismantle and replace, or repeal and replace, right? And there were a lot of folks that showed up at town halls in red districts, purple districts, that were frankly pissed off that was happening. And I see signs of that happening with the pushback against the cuts to Medicaid. So at the federal level, Protect Our Care has a coordinated effort. They're great. They have, I believe, a C3, so that's a nonprofit arm, but they also do political advocacy on the C4 side. They have a robust Hands Up Our Medicaid campaign on their website. You can, send your your message to your members of Congress. I will say, though, we have here in San Francisco, you all have a pretty great member of Congress. What might be more helpful, those of you that are from more conservative areas, purple districts, calling up your family members and asking them to put in their support. That's more helpful. I always try to get my family in Inland, North County, San Diego to, send their thoughts to a Republican member of Congress that represents them. So that's even more helpful. Fight for Our Health Coalition. So this is more local to California. I mentioned California Ethnic Health Network. They're a great organization. And there's a typo here. I believe it's Health Access as well. They've joined forces to reactivate the Fight for Our Health Coalition. So at the state level, that coalition fought against the ACA repeal during Trump 1.0. They've reactivated. They have a number of events at districts here in California. They're going to make a difference. Those districts in the Central Valley, in the Inland Empire, on Riverside, San Bernardino, those members of Congress will be those critical votes, those Republicans that are in districts that happen to have a lot of low-income folks that are on Medicaid. So it's going to impact their constituents. And the last kind of area where I seen promising signs at the federal level, we talked about the attacks to higher ed. This is kind of wild to me. I mean, the cuts to healthcare, like I get it, but the attack on education, on science, independence of institutions like UCSF is kind of incredible. I didn't think we'd be here, but here we are. And, I think the first couple of months, there was, a lot of schools kind of preemptively started removing language, scrubbing their websites, right? And, I think they probably went a little bit too far because Harvard, was it a week or two ago, they announced that they were going to fight back. And they weren't going to take it, right? So our nation's oldest institution of higher education, they not only pushed back and said, no Trump administration, we're not going to do what you say and hire the people that you want us to hire and admit the students that you want us to admit. But I think what's important here, again, going back to the narrative, it wasn't that they put out that press release from the president, right? But if you went to their website, they completely changed their website and they focus on what are the impacts of federally funded research to the American people, to the global community, right? I know UCSF does a pretty good job. You have a great website where you showcase your research and the innovations that are happening and why it's important to fund this work. There was a sign-on letter that followed that initial Harvard campaign through the American Association of Colleges and Universities. I think it was called the Constructive Dialogue Letter. I made sure your chancellor did sign on, so good job. And I hope that this is the start of a broader coalition of institutions fighting back against what are really unconstitutional threats to higher education and their independence. Did want to give a shout out to UCSF advocates. I believe you have an active campaign around fighting against specifically the Medicaid cuts and the NIH cuts. So that's great effort for you all to get involved here locally. And it's not so much resistance at the federal level. I think we do have to defend, but what are we going to do here in California to protect, especially the most vulnerable, right? There are efforts that I think are important. I mean, there's so many, but a few that I wanted to uplift in the health advocacy space that I've been following. So on the legislative advocacy front, my former organization, Latino Coalition for Healthy California, has a bill co-sponsored with Senator Adeguin out of Berkeley here, just across the bay, and it's around protecting immigrants' access to their privacy in vulnerable settings like clinics or mobile clinics. So, this is a bill that I'm tracking that, here we go. This is a bill that I'm tracking that I think is important because, we can do so much defense, but we also have to think about what's the vision or what are the protections that we need to put in place within the state of California. And, I think really take up the mantle of being the resistance without getting in trouble. I think the governor in the early days, he was focused on wildfires response in LA, and that's very admirable and wanting those federal resources. But I do think that we need to really think about, from a policy perspective, what are the things we're going to do, the actions that we're going to take to protect access to healthcare and health equity here in California. Another kind of area of persistence, so while those attacks are potentially happening to Medicaid at the federal level, what's happening here, I mentioned the DACA ACA marketplace is, being challenged in the courts at the federal level. But there's still work we can do here in California at the state level. The Health for All campaign is continuing, their incredible progress on coverage expansion for undocumented immigrants here in California. They have a budget priority this year that is specifically around immigrants' access to Covered California. So that's the ACA marketplace here in California. So again, another great effort of how we can advance some protections here, regardless of what's happening at the federal level. So I'm pretty much at time. So some final reflections here and these are things that have just been kind of bubbling up in my head the last couple of days while I was putting together these slides, and really curious I'll be around, by the way, throughout the day and want to hear from you all on how you're thinking about this, because I don't think anyone's solved it yet. We're like in the middle of it right now, right? In the beginning stages of it. I think it's really important, especially from kind of your purview as researchers, clinicians, what's the problem you're trying to solve? It feels very overwhelming, but if you can get specific, is it coverage or within coverage? What part of coverage? What's the problem you're trying to solve? And I think you all are really good at that, but getting some clarity and just chipping away at that, I think it's really helpful. It's helped me in my work and health policy advocacy, and just being more clear about the problems that you can establish better interventions or policy solutions. Going back to the advocacy tools, I think we need to sharpen them. I don't think we need to throw them away or start anew. I think there's a lot of tools, grassroots organizing, coalition building, narrative change that still work. But I think we need to sharpen them and be a little bit more forceful in our fight in this moment, because we are in the fight of our lives when it comes to public health. Find your puzzle piece. Earlier in the toolkit, it might be that research for you and making it more actionable or more accessible to more audiences. But it might be, other opportunities for you to get involved. So think about that. Don't do this work alone. I think that is the worst thing you can do, right? Is just kind of doom scrolling. And I know I've been a victim of that. But it's really moments like this when I get out of kind of my doom scrolling and connect with others, people that are like-minded, where I feel motivated, engaged, and I feel like there's opportunity for movement. Build that community, right? Know when to take a break. So I've been kind of at the tip of the spear of policy advocacy for a good part of 7-8 years. I was pretty burnt out at the end of this last administration. I don't think I knew it until I, turned in my key card and slept for about a month. A lot of sleeping, a lot of Netflix. But it's okay to take a break, recharge, but then come back to the arena, to the fight. Resist, persist, and repeat. Lead with values. So this is really important. I was going to tell a story really quickly. I should actually tell the story because I'm at UCSF really quickly. During the beginning of the first Trump administration, I was still finishing up my DRPH. I was doing my final practicum doctoral thesis. I was a consultant at Kaiser in Southern California. I didn't know what I was doing with my life. I was pretty depressed with what had happened that election year, and I joined a webinar, and randomly a UCSF professor, Dr. Arina Pasic, was on that webinar, and she was actually co-PI of a program that I did when I was in my MPH program, Berkeley, the MTP CCR program, which helped underrepresented folks, continue on their educational path from a master's program to a PhD or DRPH. And she said something during that webinar, and she said, we are all guardians of health equity, and that phrase really just resonated with me, being a guardian of health equity. So and that really motivated me to get into the arena, go into health policy advocacy, and that's how I ended up at Latino Coalition for Raleigh, California. So leading with those values, I do think healthcare is a human right. I think probably most of you share that value, leaning in on those values because it's going to get you through the tough moments. And, I hate to say it, but a lot of this work, we're kind of not fun to be around. So what I like to say is, it's okay to be joyful. Let's be joyful in the process. I don't know what is a better calling in life than to protect people's health, the most marginalized among us, and advance that. So let's have fun while we're at it. So with that, thank you. The picture on the left, that was when I was trying to figure things out, finish up my DRPH. I was one of thousands at Women's March early in the Trump 1.0 administration. Just 2 years later, I was sitting with leaders in Sacramento with the governor, the former Attorney General of California, and this was the announcement, the press conference for one of the many lawsuits that California charged against the Trump administration. This was for the public charge ruling, which would have had detrimental impacts on immigrants' access to health care. And, you never know. Just get engaged, be in the arena, and it's going to take all of us to win. So thank you all.